Did you know that your vagina can actually flip inside out and come out between your legs? Hi, I'm your local OBGYN, and what do you need to know about prolapse? So, the vagina is just basically a tunnel of thin tissue supported by some very important structures that hold it up. But there's a bladder, a uterus, bowels, and a rectum that all surround the vagina. And if any of those start to cause increased pressure on the vagina and those ligaments that hold it up start to fail, it can start to push the vagina down and actually prolapse outside of the vulva. Okay. This can look like a little bulge, kind of like a little pink balloon between the labia, or it can completely flip inside out and look like a grapefruit is hanging out of your girl parts. Why does this happen? Okay, coughing, weight, smoking, big risk factors for it. Having lots of babies puts a lot of pressure on those ligaments, so it can certainly weaken it up over time. Connective tissue disorders are a big one as well, and sometimes it just happens. So what can you do? You see the gynecologist, you should get some testing. There are options for conservative versus more significant surgical interventions. So you can try pelvic floor therapy, but a lot of the time those ligaments can't really get strengthened in the same way. All right, so you're going to need something more. There's something called a pessary, which is like a silicone type disc or shape that gets inserted into the vagina and pushes everything back up. Or you can see a specialist called a urogynecologist whose whole job is to redo your anatomy to make it the way that you came into this universe where everything is back up in place. Definitely common, definitely manageable,